health segment because Linord Moudou is back and she's here with a look at Ebola in West Africa and a new drug to fight malaria. Linord.
Hello, Vincent. Hello, everyone. Scientists have discovered a new anti-malarial compound that could treat patients with a single dose. The new compound works differently than other drugs by targeting part of the protein maker within the parasite. It should be effective against the current drug-resistant disease. The plan is to advance the experimental medicine into clinical trials within the next year to assess its safety and efficacy. The compound was developed in Scotland by the University of Dundee's Drug Discovery Unit and the non-profit Medicines for Malaria Venture. The scientists behind the project estimate that it should cost about $1 per treatment, putting it within reach of the most affected patients who live in poor countries. Now, a spike in the number of Ebola victims in Guinea has citizens and health officials in West Africa concerned about a possible return of the deadly disease. VOA's Pearson reports on the obstacles to getting rid of the Ebola virus.
It's the start of the rainy season in West Africa when roads turn to mud, making it hard to get medicine and supplies to those with Ebola. This is just one of the obstacles to ending the epidemic in Guinea and Sierra Leone. Others include attitude. People in these countries have been living in the midst of an Ebola crisis for more than a year, and that can make a deadly virus seem normal, says Dr. Bruce Aylward from the World Health Organization.
Over time, people get used to Ebola. In these communities, we're seeing people trying to treat Ebola at home when they know it's Ebola, trying to manage it at home by taking precautions and wearing gloves and things like that. And I think at a different level internationally, people are, and in a different way, getting used to hearing about Ebola, which is really, really scary.
Stigma, fear, and denial are associated with the disease. Ella Watson-Stryker spoke about it in a webcast from Doctors Without Borders, or Médecins Sans Frontières.
Ebola is a disease that creates fear, and everyone's afraid, whether it's the leader of a small village, whether it's the president of a country. The doctors and nurses who respond are afraid, the health promoters who are there trying to talk about Ebola are afraid, and our patients are terrified. And so I think that's the biggest barrier that we have to overcome. And something that we learn again and again is that when people are afraid, denial becomes a really good fallback.
Finding out who has had contact with a sick person is as crucial in controlling Ebola as getting people into treatment centers. Sophie Sabatier, also with Doctors Without Borders, spoke with VOA from Conakry.
As long as there is one case of Ebola, the epidemic is not finished.
Another obstacle, poor public health systems. Many West African hospitals lack running water and electricity. Sierra Leone, Guinea, and Liberia are asking the international community to help them build modern health facilities. Dr. Tom Frieden of the U.S. Centers for Disease Control emphasized this need in a speech at the World Bank in March.
The public health infrastructure is crucial to get to zero and to stay at zero.
Dr. Frieden said a good national health system will always be able to respond faster than the international community can at the beginning of an epidemic. Carol Pearson, VOA News, Washington.
And that's our Africa Health Report for today. Vincent?
Well, thanks a lot, Linord. Be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.